Why does an enlarged prostate lead to urinary retention? Have you ever wondered why an enlarged prostate can make it hard to urinate? This condition is known as benign prostatic hyperplasia, or BPH for short. The prostate gland is located just below the bladder and surrounds the urethra, which is the tube that carries urine out of the body. When the prostate enlarges, it can press against the urethra and narrow it. This compression makes it difficult for urine to flow freely. As the prostate grows, it increases the number of cells in the gland. This growth can cause the urethra to become obstructed. When the urethra is narrowed, men may experience a weak urine stream, difficulty starting urination, or even complete blockage of urine flow. This blockage can lead to urinary retention, where the bladder cannot empty completely. The prostate is not just a simple gland. It also has muscle fibers that can tighten around the urethra. When these muscles contract, they can worsen the obstruction, making it even harder to urinate. As a result, the bladder has to work much harder to push urine through the narrowed passage. Over time, this extra effort can cause the bladder to stretch and become less effective. If the bladder cannot empty properly, it may lead to urine buildup and potentially backflow into the kidneys, which can cause serious complications. Many men with an enlarged prostate experience symptoms like frequent urination, urgency, and hesitancy. In severe cases, acute urinary retention can occur, which is a medical emergency that requires immediate attention. To help manage urinary retention caused by an enlarged prostate, doctors may prescribe medications that relax the muscles in the prostate and urethra. These medications can improve urine flow. If medications do not provide relief, there are minimally invasive procedures or surgeries available, such as transurethral resection of the prostate. This procedure removes the tissue that is compressing the urethra. It is important to note that while BPH is a benign condition, it can sometimes be confused with prostate cancer, which can also affect urinary function. However, the causes and treatments for these conditions are quite different. In conclusion, an enlarged prostate leads to urinary retention primarily due to the compression of the urethra, obstructing urine flow. Understanding this condition is essential for effectively managing urinary symptoms and distinguishing between benign and more serious prostate issues. Always consult with a healthcare professional for personalized advice and treatment options.